Balance. Come in,
Balance.
common sense. It's interesting. I mean, I've been in practice for over 40 years, and we do integrated medicine here at Dow Wellness in Santa Monica, and we see patients of all kinds. Majority of patients are very open-minded, and we're able to impress upon them that, listen, what you do matters, what you eat matters, and how you manage your stress and the healing process, everything works together to get you to, this point to where you want to go.
It's funny as they're saying this, and we were talking about you training for, that 1 week walk that you're going to be doing. Very much the same time period, I'm going to be doing a cold plunge experience with Wim Hof. I don't know if you've heard of him.
Oh, Wim Hof, yes.
He's the one that popularized it.
Yes,
so I'm going to be with him and doing the whole retreat. So it's going to be interesting.
We should compare notes afterwards.
Yeah. I think yours is going to be a little bit more relaxing than mine, but hopefully we'll survive out of this.
Yes.
So you come from a generation, 38 generations of within your family practicing traditional Chinese medicine. For someone that hasn't heard of Chinese TCM before, how would you explain really what the core fundamental pillars are and how it differentiates or how it's different from perhaps what the Western medicine stands for?
Yes. That's such a relevant question today. I always joke that I was born in the lucky sperm club. So meaning, my ancestors been practicing Chinese medicine for a long time, over 1,000 years, and all those generations later. I've also been trained in Western medicine too. So what the unique aspect is, I'm able to straddle and understand and translate between the two. So from a fundamental sense, traditional Chinese medicine or acupuncture, because some people know Chinese medicine through acupuncture. Acupuncture is just one of the modalities of Chinese medicine. Chinese medicine is pretty all-encompassing, but its core theory is this, very simple. Your body can heal itself. Our job as a healer is to assist and awaken the body's healing mechanism, its healing capabilities, and then facilitate it. Nourish the body so that it can do what it's supposed to do. Acupuncture is to awaken that. So if you think about acupuncture, it's to signal the body's own healing capability. The body's doing all, and we can measure the changes, the biochemical changes that are happening in the body. And then you assist that with herbs. So Chinese herbs is very similar to pharmaceuticals. And in fact, pharmaceuticals in the earlier days were extracted from herbs, particularly Western herbs, but now increasingly we're seeing some of that, coming from Chinese herbs as well. These are the actual herbal medicine that's used to assist the healing process. And the diet, food is medicine concept. Every food has a particular therapeutic value. And the movement, we talk about Tai Chi, Qigong. There's a Taoist yoga called Tao Ying. So we do all of it, and meditation, guiding the patients back to health in terms of their mind, their body, and spirit, right? So all of this. So we work with the body, we work with the person, because it's like looking at the forest, and there are many trees in the forest, right? So, and the trees represent the parts of your body. Then we contrast it perhaps with the allopathic way of looking at, this is the Western medicine approach, looking at the body, which are more or less in parts. So if you have heart disease, you go see a cardiologist. If you have, sort of stomach issues, you go see a gastroenterologist. You have hormonal problems, you see endocrinologist. You have skin problem, dermatology. So it's a bit fragmented. And so you go to different specialists to see for a different problem, in your body. And yet, what you need someone to tie it together. Well, that's the job of a GP or an internist, right? So a general practitioner is supposed to kind of look at the whole picture and be your quarterback. But they're so busy today, they got 7 minutes allowed. This is kind of insurance billing, right? 7 minutes, you got to justify it for that time. Anything beyond that, you have to sort of write a report just to kind of be paid for. It's really the way that medicine's being practiced today here in the West, allopathic medicine is really, shall we say, patients would say, leaves more to be desired, right? Because they feel like they're not really looked at and talked with and touched even. Most doctors don't touch their patients anymore. It's all labs and imaging and so forth. So, so Western medicine is a little more fragmented in terms of the approach to this health and restoration. And also, it's a reactive medicine. Don't see me unless you're sick. Now, there is a concept of wellness physical checkup, right? So you go to your doctor once a year, even if there's nothing wrong with you, just as a checkup. So there's a more emphasis now kind of going into more of a prevention. So we can say Eastern medicine up to this point has very consistently focused on prevention, on how to work with your body and how to maintain balance, right? So assisting the process, healing process, but respecting nature, respecting that your body can also heal. Western medicine is more interventional and it's more reactive and it's more specialized. So, kind of treating the tree and losing sight of the forest, because the human being is mind, body, spirit, and not just the body or just the mind or just the spirit. But we've seemed to have compartmentalized all of it. And farmed out to different specialties. But the combination, the integration is beautiful because Western medicine does excel in diagnostics. The technology-based medicine can see, very detailed, specifically, what we may not be able to detect in Chinese medicine. However, Chinese medicine can read into a person's mind-body balance and the interaction between the two better, than the sort of the fragmented specialties of Western medicine in that way. So the future is here already. We already practice integrated medicine. And through our school, we have a graduate program at school called Yosan University. We named it after our grandfather, Yosan University of Traditional Chinese Medicine here also in Los Angeles, where we train our students. They have to learn Western medicine and also Chinese medicine as well, so that when they are in clinic, they can speak both languages and they can help translate and understand the body from a holistic perspective, but also in a specialty perspective. And this way you kind of bring the best of both worlds.
Yeah, because it's not that one strategy or one school of thought is better than the other. They bring their own unique things, but they also have, I see Western medicine being reductionist by design, which in some sense can be powerful because that's where you have vaccines, antibiotics, and so forth that can come with that. But it seems like with the East, it's more around the lifestyle factor, everyday symptoms that may come through that you can incorporate into your daily habits. It's interesting to see how they're coming together. I always joke that these things that are now trendy in, more Western society, whether it's intermittent fasting or herbal teas, stuff like that, these are all things that Asian grandmas have been telling us this, our whole lives, and now it's like this trendy thing. And it's great to see, though, it's coming together at the end of the day. I want to go deeper into some of these other pillars like Qi, which is spelled QI for people listening. What is Qi exactly? And how is this all incorporated into TCM?
Well, Qi is very fundamental to the whole, I would say, theory of Chinese medicine. Energy, and that's really how it's translated, but some translation we call a life force. They're all correct. If we do a reductionistic aspect of what Qi is, it's the electromagnetic energy that's running through our body. There's also thermal, and on the electromagnetic spectrum, there's also light. And interestingly, there's biophotons coming out of our cells. So there is also light. So we're a light-emitting being as well, right? So, but all of it collectively runs our body. As soon as that electrical signal stops, that's it, you're done. And that's essentially, like the, whether you have a sign, of life or not, is when you flatline. There's no more signal coming, right? And so if you want to understand it from that perspective, great because it's energy. That's what it is. But qi is so fascinating because qi is also informational. So just like when we can transmit messages in a copper wire in the old days, telephone on one end, right? And then there is all these basically signals, 0 and 1, and then it gets translated, right, on the other end through devices. Then you can understand, oh, the voice is coming through, the message coming through.